and welcome back to another edition of the Kellum Connect MD video podcast minute. Gabe Farias, Dr. Danny Kellum. We talk health, wellness, life, love. Have you ever talked love before?
Not with you, Gabe.
Not with me. Okay, well, each week we touch on different topics in the health and wellness community here in the Tri-County, San Antonio, Bexar County area. Remember, this broadcast is brought to you by KellumConnectMD.com. If you're feeling bad, if you're feeling feverish, you don't want to leave your home, visit KellumConnectMD.com. Enter the coupon code SCHOOL, SCHOOL, all lowercase. You're going to get $10 off of your visit to see a medical professional online and on time. Skip the waiting room, folks. KellumConnectMD.com. Dr. Kellum, we have started school.
Yes.
Flu season is upon us. We have flu shots. Talk about the importance of getting your flu shot.
So it's interesting, and not to mince words, but I think it's important that we really haven't actually seen flu season to start, meaning that we haven't had a lot of people come in testing.
Go ahead and show everyone that I'm an idiot. Great job.
Gabe, let me just
Does
say,
it not take a lot to show that?
Not a lot at
there you
all.
go. Okay. Not a lot of effort. Okay.
You do a really good job at
of doing that on my own.
You must be a professional.
I'm a professional idiot looker.
Yes, you are.
Yes, I am.
We digress.
Yes.
Flu season's not necessarily here yet. We have not had a lot of people coming in with the flu, high fever, body aches, those types of things. But that's a really important point. When people do start to feel that, it's imperative that they call KellumConnectMD.com, call our office 945-2121 to get some information, because what we know for individuals is that when we implement therapies early, we really can reduce severity, we can reduce duration, and it really does make a difference in terms of getting people back to normal. What's really important, I think, for today, though, is preventative stuff. And so we for flu season, we really sort of begin with immunotherapies. And so now we've got the flu shots in, and you will see them at Walgreens, you'll see them all over the place. It's really, really important for people to stop and get their flu shots, because what we can do is prevent these issues from coming, or at least lessen the amount of symptoms that people have. And it's absolutely important for saving lives and keeping people healthy, especially over the age of 65.
And when you get your flu shot here at Kellum Family Medicine, what it does is, yes, it does prevent you from getting the flu, but getting the flu can lead to some really serious issues. So nip it in the bud right now.
Absolutely. Unfortunately, people have a lot of concomitant issues that come with that, whether it's chronic bronchitis or COPD or heart histories, congestive heart failure. I mean, there's a lot of unfortunate things that can go along with that. And anything like the flu that can compromise their health really can lead to sequelae of disease that really become very difficult. And those are the things that really end up being an issue. We get people in the hospital, we get people feeling sick, and thank God right now we have a wonderful program, what we call our Transition of Care program, led by Michelle Watson, who, if you are in the hospital, will be by visiting with you, but certainly we want to keep you out of the hospital so that we can treat quickly, get you better, and get you back on your feet, because the flu, unfortunately, for individuals that haven't had it for a while, we forget how devastating it is to us, and we sort of take it for granted that it's an easy process, but we get people that die every year from that.
Sure.
And that's not something we certainly want.
And even for you, your deal is, yes, we'd love for you to come in and get the flu shot here. However, just get the flu shot.
Yeah.
Take care of yourself so that 6, 8, 9 weeks from now, when you're in the middle of the dog days of winter, you're not coming in with pneumonia or any type of activity that comes as a result of having the flu.
That's absolutely true. What our main focus is really the care of our patients. And it doesn't matter to me if you get the flu shot here or you get it wherever, because what I care about is the fact that you're protected and you're taken care of, because it ultimately really will make you healthier with that. And it helps all of us in keeping you healthy and doing better. And so I would love for you to come in if it's convenient and easy, but really for me the most important thing is your health, and that's what we drive everything by, is making sure that you take care of yourself first. And so however we can be a part of that, we'll be happy to do it, but please know the importance and get that taken care of as soon as possible.
I'm a 48-year-old man, so I know that I'm going to get a flu shot. What if I'm a 78-year-old man? I know that seniors also always have that kind of hesitation. What do you say to seniors that are looking to get the flu shot?
The problem with that, I think, and it's true, is that a lot of them come in and say, "Oh, I haven't had the flu for 50 years," and it's hard to argue that, because these people are smart, they're experienced, they understand their bodies. But what I would say is that it only takes that one time, and it's in that one time that we don't know how people are going to react. And you can only play odds so long. And so what I would say is get the shot. They're very well tolerated these days. The shots that you got 40 years ago that made you sick are not the shots we use today. And it's important that you get that taken care of. We don't know if you're going to get it or not, and we don't know how severe it's going to be or not. And I would say it's not worth that chance, because if you're feeling well and doing well, and God forbid you get the flu and you end up in the hospital, it may be unnecessary just because of that little stubborn streak that you've had it before. And so what I would suggest is get it taken care of. You don't have to worry about it. It's very well tolerated. I had mine 2 weeks ago. Did not have any issues with it at all, but now I have a sense of protection about me that I feel comfortable with, and it's good.
And come on in, 210-945-2121 to set up an appointment, or you can visit our website, kellumfamilymedicine.com.
May I say something?
Yes,
sorry to interrupt
you are the boss. You sign my checks. You can say whatever you want.
Just one little thing, and it's really important, is that for all our patients out there, what we really are pushing is an opportunity to really understand. If you God forbid are in the ER in the hospital, please let our practice know, because this program that we've set up with Michelle Watson is a wonderful program. And the thing that really was bothering me more than anything else is that we began to feel a little bit disengaged by the patients that were in the hospital. People go to urgent cares or ERs or other physicians, which are all okay, but they would end up in the hospital and we wouldn't know about that. And I think our greatest advantage for our patients that we take care of is coordination of care, and we're able to chase their records, understand what different people do, but also help coordinate the care in the hospital, out of the hospital, and from time forward from there. We've been doing this for 25 years. Those people that admit in the hospital, we have had relationships for long periods of time. But what we really would encourage our patients to do is to let them know that you are a part of Kellum Family Medicine. They'll get in touch with us at the time of admission. We'll be able to take care of our end to make sure that things aren't being dropped. And what we don't want is for when people to get discharged, for the care that they need to not be followed through with, because we don't know what's happening with that. And so I think it's a wonderful program that we visited. We do a televisit with individuals as they leave the hospital. We've got a wonderful young lady that manages this program for us. And so it's something new at Kellum Family Medicine that we're trying to do, but we want the continuum of care to be when you're healthy and when you're sick and when you're back home again, because we feel like we're family. And if we can take care of our family, both in the hospital and out, I think it's when we're going to be doing the best jobs with that. So, plug I wanted to bring. Thank you.
Yeah, well, and just to expand on that, as part of this transition of care position that we have, this individual, Michelle, who does a fantastic job, a lot of you will have seen her as an MA, as a medical assistant. She actually goes to the hospital and visits with you face to face to check on you, because, again, it's a part of the fact that you want to create, or you want to continue that connectivity to your patients in all realms of medicine.
Absolutely. And the other part, too, I will tell you, is what I like is the face-to-face visit before you leave, which you will have with me. Because if there's issues that you've had, or there are problems that you had, or there's things that you want to encourage the hospital about, we have good relationships with the hospitals that we use, and we're advocates for our patients. And if there's something that's not happening that should be happening, believe you me, we will be on them immediately to make sure that we get the things taken care of that you deserve. And so please, and we will continue to push this out there in the emails that we send to y'all, whether y'all like that or not. But we will keep pushing that out there to make sure that you understand that we want to be a part of your care, not just in the office, but in the hospital as well. We've done it all of my career, and I think it's an important part that we've been lacking, and certainly a part that we're going to take back over again. And so, just out there for people to know. Yeah,
just remember, let them know you're a patient of Kellum Family Medicine. Again, circling back to the flu shot, if you need a flu shot, if you want to come in, get that flu shot, give us a call, 210-945-2121. Visit KellumFamilyMedicine.com, or you can go to our Facebook page at Kellum Family Medicine. Also, remember, this broadcast is brought to you by KellumConnectMD.com. Enter the coupon code SCHOOL, and you're going to get $10 off of your visit. Dr. Kellum, good job. All right, folks, stay healthy.